Hi, my name's Rachel Hiller. I'm co-director of the UK Trauma Council and a professor in child and adolescent mental health at UCL. In this video, I'm going to talk you through the NICE guidelines, what they are, how to use them, and what it means for service provision. NICE guidelines provide a roadmap for understanding best evidence practice for supporting a wide range of mental health conditions. So it's crucial that commissioners and leaders have a solid foundational understanding in how they should be used in mental health services, for children in care, but also for all children. NICE is short for the National Institute for Health and Care Excellence. They provide freely available, evidence-based recommendations for the health and social care sector. And these are what we call the NICE guidelines. These guidelines are developed by an independent committee comprised of experts in that particular condition. This includes frontline professionals, academics, experts by experience, members of the community, and other stakeholders. The guidelines aim to promote good health and to improve the quality of care and services. The NICE guidelines cover a huge range of conditions, including physical and mental health conditions. They don't only provide information on best evidence treatments, but also on assessment and considerations around access and implementation. Almost all diagnosable conditions will have a NICE guidance to support treatment delivery. So they're a really amazing resource when we're thinking about service provision. Of note, in relation to children in care, there are also NICE guidelines specific to this group that are called the NICE Guidelines for Looked After Children. These guidelines are there to help practitioners and carers to improve outcomes for this group of children and teens and have a particular focus on placement stability and nurturing relationships. These NICE guidelines provide a potentially useful avenue for understanding broader prevention strategies to improve outcomes for children and teens in care. In practice, they can unfortunately be used as a reason not to provide best evidence mental health care. For example, for many children in care, the mental health service in their region might only be commissioned to work with the network around the child, carer training and support for social work consultation as examples. This is such important work, but if it's the only offer, it can also mean that young people themselves are unable to access direct evidence-based care. Often, unfortunately, the NICE guidelines for looked after children are used as a reason to justify this. But this is actually a misuse of the guidelines. These guidelines specifically state that the network work should not replace direct CAMS or direct mental health support for children. They also say very sensible points like the child not losing their place on a CAMS wait list because they move placements. When it comes to mental health, children in care should have access to the same best evidence mental health support for their specific mental health need as any other young person. And here it's the NICE guidelines for mental health that we want professionals to be using. Children in care have high rates of common and trauma-related mental health conditions like depression, anxiety, post-traumatic stress, and conduct difficulties. They also have higher rates of neurodevelopmental conditions such as autism and ADHD. Despite this, they're less likely to have access to high-quality, best evidence care. Often the message is that children in care don't meet criteria for existing diagnosable mental health conditions. But in reality, there's a large amount of research showing the opposite to be true, that most children in care experiencing mental ill health likely do meet criteria for a diagnosable mental health condition, which will have a NICE recommended treatment plan. All mental health services should be building their provision around the NICE guidelines for mental health. Just like if you take your child to the doctors, you expect them to receive best evidence care, parents and caregivers and young people should also feel confident that the mental health professional they're seeing is using best evidenced approaches. So how can you access the NICE guidelines? No commissioner could possibly hold in memory all of the different treatments outlined in the NICE guidelines, but luckily there's an easy to use website, nice.org.uk. On this website, you can see a search function where you can type in particular mental health difficulties. For example, PTSD, which stands for post-traumatic stress, takes you to NICE Guidelines 116 for PTSD, where you'll see guidelines for recognising and assessment of PTSD, the gold standard treatments for children, young people and adults, as well as useful information around access and implementation. If you really wanted to deep dive, you can also find all of the different published research papers that have been viewed as part of the development of these guidelines. When you're commissioning or supporting a mental health service who are expected to deliver mental health interventions to children experiencing mental ill health, central to that discussion should be whether and how services deliver NICE recommended mental health treatments based on NICE guidelines for mental health. This means understanding what conditions they are working with, what therapies they're able to deliver, and whether they have capacity to deliver enough sessions to meet the child's needs, and whether they have capacity to also prioritise clinical supervision. The NICE guidelines are of course imperfect. Even with the best evidence treatments, we know that not all children will get better all the time. But these treatments are our best chance to support children to recover from their mental health difficulties.